start with the session today. Renuka ma'am?
Sir. Yes, sir.
Yeah.
Very good evening, participants. Today, welcome you all for today's session on the topic of AI-powered solution for sleep disorder management from diagnosis to treatment by Dr. K.Narasimhan, Associate Professor, School of EEE, Sastra deemed to be University, Tanjavur. He has received a PhD degree in medical image processing from Sastra deemed University. He has published more than 60 papers in reputed international journals and conferences. His research interest includes digital image processing, medical image analysis, pattern recognition, and digital signal processing. Presently, he is executing funded projects from Science Engineering Research Board, SERB, and Ministry of Heavy Industries, MHI. Thank you, sir. Over to you, sir.
Thank you, madam. My screen is visible. So let me swap the
Yes, sir,
window.
you can start the presentation, sir.
Let me put it in the full screen mode. So I cannot see this window to admit the participants. Yes. Very good evening.
Sir,
Yes, yes, madam. Screen is
the
visible.
presentation. No, sir, you are present. Our
Just a minute, madam. I will
title
change.
slide only visible, sir.
I will change the window.
Yes, sir. It's visible now, sir.
It's visible now.
Yes, sir.
Yeah. Very good evening.
Sir, full
Today,
screen, please.
full screen only, madam. I put it.
Okay, sir.
Uh, Very good evening. Today's topic is how we can leverage artificial intelligence for sleep disorder management from diagnosis to treatment. So I have planned my talk in such a way that you will see the introduction to sleep disorders, types, the prevalence of sleep disorder in India as well as in globe. And generically, we will see what is the need for AI in healthcare. We will also see the flow chart of any clinical decision support system development using biosignal. And two of our research scholar publications I have taken. One is with respect to obstructive sleep apnea diagnosis using EEG signal as a case study. Another one is from electroaglogram signal and electromyogram signal. It's also a publication from our research scholar, followed by the conclusion. So in general, sleep disorder is any medical condition that disrupts the normal sleep pattern. So in general, we need...
Excuse me, sir. Are you changing the slide, sir?
No, madam, no. Here, let me admit few students, few participants, then let me proceed.
Okay, sir. Thank you.
Is it visible? Introduction slide visible? Slide number 3.
Yes, sir. It's visible, sir.
So sleep disorder is a medical condition that disrupts the normal sleep pattern. So in general, it affects the ability to fall, stay in sleep, or achieve restful sleep. So these disruptions obviously results in daytime fatigue, decreased productivity, and impaired physical and mental health. So various factors that we will see in the following slides in detail, which include stress, psychiatric condition, environmental influences, genetic reasons also. So in general, sleep disorder is grouped under two headings. One is dysnomia and another one is parasomnia. Dysnomia issues with the quantity and quality of sleep and the duration of the sleep. Parasomnia with respect to abnormal behavior or physiological events occurring during sleep. So major focus with respect to biosignal, using the biosignal, the diagnosis is done only with respect to dysnomia. So if we see the statistical report in India, particularly if you see the leftmost slide, it is given with the different amount of sleep durations. So 10 plus hours, 8 to 10 hours. Minimum expectancy is 6 hours of sleep. So if we can able to see here 21 percentage of people having a lesser duration sleep, up to 4 hours only. And in general, 55 percentage Indians surveyed getting less than 6 hours of uninterrupted sleep. 28 percentage say sleep quality has deteriorated after COVID pandemic. And the reasons are highlighted in the middle one. Maybe it's not legible to read. Different reasons, starting from mobile call, and then children interruption, scheduled household activity, uncomfortable bed, many reasons. And the last one, right one survey indicates that whether what is the COVID impact with respect to the sleep. And we can see the response in red color. 28 percentage say that COVID has caused the sleep disturbances also. And if you observe this bar graph, the number of people, percentage of people is getting increased who are getting less than 6 hours of sleep. It was 50 percentage in the year 22, and it is increased to 61 percentage in 2024. So, and in general, the right side graph indicates with respect to age. So it's very prevalent that with the age, normally the sleep duration decreases. It's a general observation. So that particular, just a minute. I think, okay. This slide is okay, visible now? I think
Yes, sir. Visible, sir.
okay. So in general, if you observe this graph, in the x-axis, if you observe seniors, older adults, and young adult teens. So normally, teens experience more amount of sleep time. Of course, they need. So with the seniors, the percentage of sleep time keep on decreasing. So significant causes for sleep disorder includes various factors like medical condition, which include different reasons, starting from chronic pain to hormonal changes, respiratory issues, neurological condition like that. So physiological factors, lifestyle habit, environmental factor, diet and substance use, genetic and biological factors, aging. So the major reason, the personally I feel, due to the use of electronic gadgets and maybe dinner time, everything is getting delayed. That may be the probable reason. So, so in the beginning slide, I said there are two different. We have further 5 classes like insomnia, sleep apnea, restless leg syndrome, narcolepsy, and circadian rhythm disorder. Among these, very prominent problem, more number of people facing is sleep apnea. So normally in clinical literature, we used to call it as obstructive sleep apnea, and it is abbreviated as OSA. So OSA is normally is due to the breathing interruptions during sleep, often caused by obstruction of the airway. So in general, it leads to decreased oxygen level and frequent awakening, disrupting the sleep quality. So one of the biosignal which is predominantly used is polysomnography. It's not a single signal. It's a group. We'll be using electroencephalogram electrocardiogram, and of course sometimes EOG also included, oxygen saturation signal. So sleep apnea among the five is the major one. Other than that, if you observe insomnia, that is difficulty to get sleep or staying asleep. So there recently more amount of LLM based, large language model based behavioral, that is cognitive therapy also is given by means of chatbots. AI powered chatbots simulate cognitive behavioral therapy, offering interactive and personalized treatment session. RLS, uncontrollable urge to move the legs, especially at night. Narcolepsy, during the daytime itself, sudden and uncontrollable episodes of sleep. Even in our day-to-day life, we might have observed some people, they'll be awakening, all of a sudden they will get into sleep. So sudden uncontrollable episodes of deep sleep during the daytime, narcolepsy. Circadian rhythm disorder, misalignment of the internal clock, such as jet lag or shift work disorder. So normally, if we move from one country to another, or there is a jet lag is there, we usually feel that we can overcome in a day or two. But these people may not be able to overcome misalignment of the internal clock. Okay, so it may be due to the
Sir, excuse me, sir. Slides are not changing, sir.
no, madam, I'm not changing.
Okay, sir.
It is due to the misalignment of the internal clock and jet lag or shift workers. Normally, shift workers, whomever is working under shift, different shift, day, afternoon shift, night shift, they may be having this problem of a circadian rhythm disorder. So in general, totally 5 cases, out of which the sleep apnea is a very prominently prevalent one. So these are the sleep stages mentioning here, given by the American Academy of Sleep Medicine. So in general, this REM indicates a rapid eye movement, and we used to say as NREM, non-rapid eye movement. So in the, here in the NREM, we have 4 stages, which include W stage, N1, N2, and N3 stage in NREM. In these signal frequencies and all is given with respect to EEG, electroencephalogram signal based one. That I will come to it later. In electroencephalogram signal itself, we will group the band like delta component, theta, alpha, beta, gamma component. So which component is predominant in each stage, that is given in this W, N1, N2, and N3. W, N1, N2, N3 comes under the broad class of NREM. Last one is REM. So the NREM and REM comes together as one cycle. So predominantly we come across 3 to 4 cycles in a night. So typical sleep cycle lasts about 90 minutes. There is no hard and fast rule. In general, sleep cycle for 90 minutes. In a full night of sleep, with the NREM sleep dominating early cycle and REM sleep becoming longer in late cycle. So breakdown of the flow, in the NREM we have N1, N2, N3. Okay, so and with respect to EEG signal frequencies also, it is given W is predominated by the alpha component of the EEG signal. N1, N2, N3 we have theta and spindle delta component. REM stage we have both alpha as well as theta together. So this is the one entire night time. We do have 3 to 4 cycle, as I said, which following this pattern, wake stage followed by REM, then NREM 1, NREM 2, NREM 3, NREM 4 is actually like this only. Actually, this N1, N2, N3 here it is mentioned as NREM 1, NREM 2, NREM 3, and 4. So understanding.
Sir, excuse me, sir.
Yes, madam.
Sir, the slides are not changing, sir.
I have changed the slide, madam.
Sir, it's still in statistical report slide only, sir. Slide number 5.
Okay, I will share the entire screen instead of window. My screen is visible now.
No, sir.
Just a minute. Just a minute. Let me close all other windows.
Sir, also some participants are waiting, I think so, sir. Kindly admit them, sir.
Yes, madam. Now it's visible.
Yes, sir. But
It's changing. Slide is changing.
for improved sleep hygiene, no, sir, it's
Fine.
not this screen, sir.
Sir, it is not presentation, sir.
The entire screen option is not coming. Only window icon. Just a minute. Yes. Now.
No, sir. Yes, sir, yes, sir. Now it's visible, sir.
Okay.
Can I change the slide, sir?
Just a minute. Now I am in slide number 6. Is it changing? 7.
No, sir, it's not, sir. Still
Okay.
in 6.
I'm not supposed to put it in full screen mode. It's not changing. Then
Yes, sir, it's now changing, sir. Types
it's,
of,
cha- it's changing
Yeah,
now,
yeah, yes, sir, not changing, sir.
but it's not in full screen mode. That is what I'm.
No, sir.
there is an issue in Google Meet, sir. Sir, please continue, sir.
Okay. So in general, let me come back. I have been discussing about the sleep stages, uh, which include NREM and REM. In the NREM, that is REM in the sense rapid eye movement, non-rapid eye movement. In NREM, there are 4 stages like W, N1, N2, and N3. So I said in sleep, one night we may come across 3 to 4 cycles of sleep. And understanding the science of sleep, if you observe NREM leads to various bodily functions slow down and or stop together. Metabolism also drops by around 15%. Both heartbeat and blood pressure go down. In case of non-REM, rapid eye movement occupy 20 to 25% of the total sleep in healthy adults. Each cycle vary in length. In general, each cycle span around 90 minutes. So deep sleep decreases across the lifespan. Deep sleep. So across the lifespan, deep sleep decreases. So as we observe in the case of as we get deeper sleep, body metabolism slowly slows down and regeneration of our body occurs. So only upon the deep sleep, on the it is but obvious we'll be getting regenerated on the immediate next day without any fatigue. So with this background, let me get into the basics. So what is the role of artificial intelligence and what is the role of machine learning and deep learning with respect to this particular sleep disorder diagnosis? So some of the benchmark data set I have given for the benefit of the participants. So in general, biosignal is available in the PhysioNet data set where you can able to get different types of signals starting from guide, tremor signal, guide signal for Parkinson, say for example ECG signal, different disorders. So we do have sleep apnea database in the PhysioNet. It may be like a polysomnography signal, which include ECG, SpO2, respiratory signal, and EMG signal also. So other data sets you can go through by yourself: sleep EDF data set, MMIC data set, and SHS, that is sleep heart health study. ISRUC sleep database is widely used for research purpose. These are the benchmark data set. So while going for the research publications, initially it is better. The developer model should be tested with the benchmark data set, and we can go for the real-time data. So when comparing your developed algorithm with other algorithms in the literature, in the sense it is always better to compare the previous algorithm only with the same data set. That is widely acceptable in the research community. So coming to the biosignal, often the sleep study we are using electroencephalogram, electroauglogram, electromyogram signal. So electroencephalogram not only used for sleep study, it is also used for in general for epilepsy diagnosis, and also you might have heard about the neuro one for brain computer interface, as well as for other conditions like alcohol consumption detection, even for mental stress detection, even emotion recognition. That and all we can able to do with the help of the EEG signal. EEG signal collection has become simple nowadays. Earlier it was difficult to we have to bald our head to keep the electrode, and number of electrodes also more earlier. Simply with the reduced number of electrode with the high amount of sophistication, we have the signal acquisition device for the collection of electroencephalogram signal. And these are the band designation of delta, theta, alpha, beta, and gamma waves. Electromyogram normally is used for finding the muscle signal collected to determine the muscle disorder. So normally, in general, biosignal is of very small amplitude and often disturbed by means of some other noisy interruption. So we need a preamplifier and a filter to enhance the strength of the signal. So the purpose of this EMG signal is to assess the muscle function, muscle disorder, and neuromuscular diseases. So these signals recorded by EMG are typically high frequency with muscle activity producing a rapid burst of electrical activity. So next to this is actually used for restless leg syndrome and spinal cord injuries, muscular dystrophy, myopathies, neuropathies. For the diagnosis of these neuromuscular disorder, we use electromyogram signal. Electroauglogram signal is actually it is one of the signal which has been used to monitor the movement. It is actually due to the potential developed between the cornea and the retina. Okay. So in general, if you observe with respect to eye, apart from the images, we use electroretinogram signal also. That purpose is different. Electroretinogram signal, abbreviated as ERG signal, is used for monitoring the function of photoreceptors, rods and cones, how it works. So the amount of electrical impulses produced by the rods and cone upon input light. So the conversion efficiency and all we will able to check up with electroretinography signal, ERG signal. This is actually it monitors the eye movement and assesses the ocular health. It is used to identify the sleep stages, especially the REM sleep, whereas eye movement play rapid eye movement is play a very crucial role. For REM related disorder, normally we use EOG signal. So EOG signal is actually records the potential that has been developed between the cornea and the retina. So sleep stage classification, assessment of eye order, and ocular muscle activity. So with this background, let me touch upon the basics. Why do we need artificial intelligence based system in general for healthcare? Any AI system, we call it as an AI system which think like human and act like human, and rational behavior is observed. And normally we have to go for AI based system application only when you don't know the relation between the independent variable and dependent variable. If you know the relation, these are the manipulation I'm supposed to do it on the data to get the results. So the mathematical formulation, if you know, you can apply it on the data and very well you can arrive at the result. So what is the relation between the data and the result that we don't know? That result only you want to get it, right? By showing the result, we are making the model to develop the relation between the actual result and input. In those cases only we do go for AI based application. So with respect to healthcare, if you look out for generally it reduces the misdiagnosis, to manage the big data, and also for reducing the cost, accelerating drug development. So improved patient outcome, and it's supporting preventive care, expanding access to care, and addressing workforce shortage. These are all some of the major benefits. And particularly with respect to sleep disorder, you can also look out for, we have AI powered sleep trackers, devices like Fitbit, Ring, and so we can also sleep analyzer we are having in the smartphone. Also certain apps are there, sleep score app, sleep cycle, and snore lab. And we have the clinical tools, AI assisted polysomnograph analysis to perform as a platform. It is used in sleep labs. Okay, so this is a typical diagram taken from the Iron Goodfellow standard benchmark textbook for deep learning. So we know that in general, machine learning is a subset of AI, and again, deep learning is a subset of machine learning. So if you observe in general the difference, normally we electrical engineers, we call it as a signal. Computer science people, we calling it as a data. So whatever may be data or signal, very first thing is we have to do the data pre-processing. And then in the case of machine learning based approach, we are trying to extract some of the features. So those are all called handcrafted features. So from the handcrafted features, we are making some feature database we are making, and depending on the intended task. So normally in the medical imaging purpose and healthcare purpose, the major thing, if you think like uh, it is like therapy planning or treatment planning or classification, like that only we are interested. So from the future map, we do have the target where different labels will be giving. Say for example, if you want to do the classification of normal or narcolepsy, normal OSA, it is only the binary classification task. So in the machine learning based approach, we are going for the handcrafted feature based approach. So the end result of the machine learning system depends upon the robustness of the handcrafted feature, how good your feature is. So normally, if you observe the block diagram of any machine learning system, traditional machine learning system, pre-processing followed by feature extraction, then we apply feature selection and feature ranking. So why do we do feature selection and feature ranking? Here only statistics comes into role. How far your feature is relevant for taking the particular decision. So the irrelevant features we are removing, and that is found by a certain type of statistical test where we use a test like t-test, chi-square test, p-test, like that. There are many types of statistical tests available to select the rank the feature, as well as feature selection algorithms are also there. Enormous number of feature selection algorithms, feature ranking algorithms are available. Then we form the feature table. So in general, we are classifying the data under three heading. All of you know, like training, validation, and testing. A training stage is used for training your model with the trained data, with the data where the target is available. With the target, if you are giving that framework of machine learning framework, we are calling it as a supervised learning. With the target, if you are doing is a supervised learning. Without target, if you are training in the model, it is actually called unsupervised learning, right? So now predominantly in healthcare, the reinforcement learning based approach is widely used. Reinforcement learning based approach. Why do we use reinforcement learning approach? Reinforcement learning approach actually imitate or replicate the human way of learning. By means of interaction only, we are learning. Say, for example, we are learning the bicycle in childhood. Say, so by someone ride the bicycle, by seeing we cannot learn. So some instructor should give you the instruction, and you have to sit in a cycle and you have to ride on your own. You will be following sometimes. So if you are carefully following the instruction, you can able to learn the bicycle riding in a day, in 2 days or 5 days or 6 days. It differs, it depends upon the individual. In the same way, here also, like environment agent type arrangement will be there in the case of reinforcement learning. Reinforcement learning is widely used in healthcare, especially for treatment planning, lifetime prediction. In those applications, reinforcement learning is used. So learning paradigms, uh, three major groups: supervised, unsupervised, and reinforcement learning paradigms. In machine learning, handcrafted feature-based approach. Why do we go for deep learning? If you ask me the question, the necessity of handcrafted feature extraction, we are completely avoiding in the case of deep learning. So our deep learning models automatically extract the features from the data. We do the resizing of the data and we will give it to the DL model. No need of handcrafted features. So in the deep learning model, if we give more and more amount of data, the training accuracy keep on increasing. Whereas in ML model, that accuracy go to saturation after a certain amount of training. Saturation problem will be there with respect to ML. With respect to ML, one more problem is robustness of the your handcrafted feature, automated feature extraction, and learning without any saturation effect. That is the advantage of deep learning. So deep learning, strictly speaking, with respect to deep neural network, there basically we are using the framework like something like convolution neural network, recurrent neural network, and in the generative model, we will be making use of GAN, variational autoencoder. Even like a transformer model also becomes familiar with respect to generative AI model. So coming, let us take our discussion to the healthcare. The healthcare intervention, if you observe, with respect to natural language processing using a large language model, it is used for clinical administrative documentation, speech recognition, AI chatbot, and virtual assistants. It is not only used for us, common public, it is also used for doctors. We can classify the LLM or NLP application into twofold. One is for clinicians, other one for public interface, which is useful for both clinician as well as public. With respect to image processing perspective, disease detection, process automation, early prediction uh, comes into picture. So with respect to reinforcement learning, as I said, drug discovery and manufacturing, robotic surgery, personalized medicine, outbreak prediction. See, most of the many research work with respect to healthcare is focusing on reinforcement learning nowadays, especially in treatment planning. Okay, so coming to this biosignal clinical decision support system. CDSS stands for clinical decision support system. So what are the basic stages involved? So first thing, we need a transducer to pick up the signal whose strength will be very less. So we need a preamplifier and filters, and the collected signal should be converted into analog to digital conversion by means of A to D converters. Then we are doing filtering to remove the artifacts. Then followed by we have to find the detection of event. So Here only comes in earlier with machine learning based approach. We used to extract the significant features from the signals. So with respect to signal perspective, we extract like time domain features, frequency domain features. Frequency domain feature means other name we can call it as a spectral features. Then statistical features, entropy features, like that different types of features we are extracting. You can pose me the question, why different types of features? So those who have studied have some idea with respect to signal processing may know. In general, in the time domain, we are doing with the amplitude versus time representation, and dimension of the signal include a number of independent variables. Your EMG signal, EEG signal, and all called as one-dimensional signal, whereas the image is a 2D signal, whereas MRI and all is a three-dimensional images. We know. So normally we are going for some kind of transforms, like very familiarly all of you might have come across a Fourier transform, which is used for getting into frequency domain. But the major drawback is a Fourier transform is applicable only for stationary signal. But most of the biosignal, what actually we are encountering is non-stationary, non-linear, and non-Gaussian. Non-stationary means the frequency content of the signal change with respect to time. In Fourier transform, we don't have time resolution. We have only frequency resolution. Meaning is, so what are the frequency components present in the signal? It will give. Where Fourier transform will tell you these are the frequency components present in the signal. That's all. But we need in biosignal in certain cases at what point of time we are getting that particular signal. So we need time also is needed. See, whenever you are getting the biosignal, it's very much important to know how much duration the signal is recorded, what is the sampling frequency, how many cycles you are going to take. That is important. So whenever you are seeing the data set, immediately you have to look out for sampling frequency, what is the duration of the signal, how many samples we are having. These are the major points you have to look out for. So here non-stationarity can be overcome in the signal processing literature. If you observe from the Fourier transform, we will go for short time Fourier transform, where the signal is divided into small chunks by means of window. So at least why the window? Because by cutting the signal into small chunks by means of window, at least we can able to say within that window duration only that particular frequency component occurs. Like that we can say. So here also, if you go for either a short time Fourier transform or a wavelet transform, there also the conflict comes between time resolution and frequency resolution. So nature always, like other domains also, we come across, say for example, in physics, we come across position momentum uncertainty. In electronics and all, we come across like gain. So we want the flat gain over the broad frequency range or higher gain. So gain frequency fight. So here also we cannot get time resolution and frequency resolution together good to the same extent. If you want a good time resolution, you have to compromise on frequency resolution. If you want good frequency resolution, you have to compromise the time resolution. That is where the concept comes like multi-resolution analysis. MRA comes into picture in the case of wavelet transform. Nowadays, we are using wavelet packet transform and empirical mode decomposition and all we are using. So why I am saying this? Because this one-dimensional signal, maybe in most of the research applications and all, if you see, we are converting into 2D by converting the signal into a spectrogram. Spectrogram is the one which is obtained from the short time Fourier transform, whereas the scaleogram is one which is obtained from the wavelet transform. In the wavelet transform also, again, different types of wavelet filters are there. There the concept, I hope we are using like a subband coding where the signal is divided into subbands. Okay. So either spectrogram as an input, or we can go with the scaleogram as an input to the 2D CNN, or if you want to feed the signal itself to the convolution neural network, means as such means we got to go for one-dimensional convolution neural network. So the other option is if you want to give the signal to deep learning framework, means normally we go for recurrent neural network framework. So there normally the predominantly used one is long short-term memory as well as the we'll be using like a gated recurrent unit, right? GRU will be using, LSTM will be using with respect to RNN framework. With CNN means we do go for one-dimensional CNN, or 2D CNN means we have to convert the signal into spectrogram or scaleogram, or in nutshell, we have to convert into 2D representation of the 1D signal. So if you observe here, I have given something like stages, whatever I said. In pre-processing, we have to do the filtering, normalization, and rectification. In the time domain features, what are the statistical features, mean, variance, skewness, kurtosis, something like that we can extract from the time domain. So in the frequency domain features, again, as I said, we can able to get the energy. One simple example, let me tell you. So we can able to get the energy of the different subbands. Suppose if I'm interested in the particular subband, say for example delta component or theta component, I would like to know. So that particular subband I can extract, and I can able to find the energy of this particular subband, and I can also find the non-linearity of the signal. So most of the time these signals are non-linear in nature. That is often given by this entropy features and LLE feature, Hurst exponent, like that. So altogether, I mean to say here, statistical features, time domain feature, frequency domain features, and also nonlinear features. These features help us to take some decision from the biosignal. So these features you extract, then you can go for ML based approach, or automatically these features are extracted either by one-dimensional CNN, or you can use the recurrent neural network framework. So these are the some of the algorithms given with respect to dimensionality reduction and time frequency analysis, and also for classification. And if you observe with respect to dimensionality reduction, the major one we are using literature is principal component analysis, independent component analysis. The meaning here is we have to remove those features which are not useful for any decision making, so that we are making the future vector length to be very compact. In the time frequency analysis, if you observe, we are making use of short time Fourier transform, wavelet transform, Hilbert spectral analysis. So normally, I hope you know, in general, in signal processing domain, Hilbert transform play a very pivotal role to convert the real-time signal into complex. So if you want to find out the instantaneous frequency or instantaneous phase, it is always helpful from the phase. We can able to get it from the complex signal. Hilbert transform is used for representing the complex representation of the real signal, that we can do with the help of the Hilbert transform. So time series model, normally we make use of autoregressive model, moving average model, and autoregressive moving average model. These terms are very familiar with respect to statistical signal processing perspective. In the deterministic signal processing perspective, normally you may come across all pole model, pole zero model, and all zero model. See, this actually moving average is equivalent to all zero model, and autoregressive model is equivalent to all pole model. Pole zero is equivalent to ARMA model. So it is a simple as such. In the those who are familiar with the basic signal processing thing, whenever there is no feedback in the system, okay, so we used to all zero, only feedback is there. Poles will come, poles and zeros concept we can get from the transfer function, you know. Based on that, for time series modeling, we are using AR or MA or ARMA model. So we are also projection based algorithm. We use it like TSNE plot. So other classification model, if you observe, for a hierarchical cluster analysis, partial least square discriminant analysis, decision tree, support vector machine, deep neural network, like that. So in general, you can, apart from neural network, if you observe in the classification model, there are many hundreds of machine learning algorithms. Which one to select for my application? That question comes in your mind, obviously. So generally, this machine learning classification algorithm, we can group under two common headings. One is discriminant based classifier, or discriminative model, or the generative model. Say for example, your perceptron model, for example, if you take, it will classify the classes by means of a boundary. By means of the boundary, if you are able to separate the two classes, and your objective is to find the boundary, or in general, we used to say the boundary may be the line in case of 2 dimension, 3 dimension, it is a plane. If you go for higher dimensional space, it is a hyperplane. So your if you observe perceptron model, multi-layer perceptron model. Perceptron model will do only the linear classification. Linear classification means by means of straight line, if you are able to separate the two classes, that comes under linear classification. Non-linear, in most of the cases, linear classification does not work for us. We have to go for a non-linear based classification. So like say for example, like a curve or a polynomial comes in to help us. So in the discriminant model, linear, non-linear. What about generative model? In the generative model, we look out for the data from which distribution it might have come, whether it follows the Gaussian distribution or normal distribution. So how many times that particular class has come. So like that, how the data has been arrived. Okay, like that, if you are saying example, you can say naive Bayes. Naive Bayes comes in the generative model. So in general, under classification, I am saying discriminant model. Another one is generative model. The other class widely used is your ensemble learning process. The ensemble learning model, normally we rely on a single model. Instead, we go for multiple machine learning algorithm, and we used to take combined decision. Combined decision, there maybe you might have come across something like bagging, boosting, and voting, like that you might have come across. So here, that is what list of models I listed, even like your decision tree, random forest comes under your ensemble model algorithm. So discriminant model, generative model, ensemble model, like that we are going. With respect to feature wise, statistical features, time domain based feature, frequency features, entropy features, nonlinear features we are extracting. So these feature extraction process you can get rid if you get into the deep learning based model, right? So let me answer some question if you have. Saravanan sir, if you have any questions, please can unmute. You can ask. You raise your hand. Let me answer a few questions before getting into the next subheading. Slides are not changing. Do you able to see this SPML algorithm slide? That is what I'm using. Slide number 22. Slide
Yes, sir. Yes, sir. Yes, sir. It's visible.
Slide number 22 only. I'm here.
Yes, sir.
So far, if you have any question with the basics, please feel free to ask. Okay, no questions, then let me proceed. Okay, so with respect to dimensional array deduction, time frequency analysis, and then classification, and anything, either it is ML or a DL, basically there are three components will come: representation component, optimization component, and evaluation component. Representation, optimization, and evaluation component should come, right? So these block diagram actually indicates whatever I said in the learning paradigms, supervised, unsupervised, and reinforcement learning approach. So unsupervised learning, you can think like without target. If you are going, that is unsupervised learning. Examples you can take clustering. The agent environment approach by means of interaction learning and reinforcement learning approach. And so here some of the queries are answered like what, why, and theory, like that. And one more advantage of reinforcement learning is compared to other learning paradigms, after deployment of the model in real time, there is no more improvement in the model performance. Once you get into what you can say, once you get into the exam hall, it's an analogy. No more you can able to learn. No, whatever you know, with that only you have to answer the questions in the question paper. Like that, there is no possibility of improvement in the case of supervised learning. Once the training is over and you have validated the model with some data and you have done some kind of hyperparameter tuning, over. Afterwards, it's only with respect to testing. So how the model behaves, and normally with respect to evaluation component, we'll be evaluating the model with respect to healthcare perspective. Basic metrics is here from the confusion matrix. Okay, and normally we'll be evaluating with sensitivity, specificity, precision, recall, and F score, like that. You can also pose me the question, why not one factor is enough, only accuracy alone we can take, like that the question comes. It's not so. Why accuracy alone is not a reflective metrics of the model? Because accuracy tells you overall performance, how good your model, average performance. Okay, so but we want to know how good your model in predicting, say for example, in our case, a normal patient as normal, obstructive sleep apnea patient as OSA patient. Like that also we're interested. So we want different metrics to evaluate the model performance with respect to different perspectives. So this is actually the basic cheat sheet. You can see this website where you can able to download different cheat sheets, which gives you the overall idea. So basically, in machine learning or deep learning, the two factors often you come across is the bias and variance. So what is bias? Average performance of the model we are indicating with the expectation. So in a statistical thing, for taking the mean, we used to take expectation. It's the error between the average model prediction and the ground truth. So in general, say for example, the predicted value is something theta hat. Expectation of theta hat minus actual value is called your bias. Unbiased model, we want always unbiased model. Unbiased model means the expectation of the estimated value should be equal to the true value. Expectation of the estimated value, if it is equal to true value, it is called unbiased estimator. Another daunting figure is variance. So variance, we know it's a deviation from the actual value, how and the spread of the output. So we want always minimum variance unbiased estimator. So in the literature, we used to call it as a MVUB, a minimum variance unbiased estimator. We want to reduce both bias as well as the variance. That is normally given by these kinds of diagram. This in literature we call it as a bullseye diagram. There are two parameters are there, bias and variance. Obviously, four different types will come: low bias, low variance; high bias, high variance; high bias, less variance. Anyone can answer me which options we prefer among the options with respect to bias and variance trade-off? Which one we prefer? Under anyone know about the this particular graph? Even right side I given you the graph. You can able to see the blue colored one is actually called bias graph, and this one is called variance graph. And if you are able to observe in the x-axis, it is actually the model complexity. The y-axis, it is the performance. So what do you mean by high bias? High bias means it is an overly simplified model. High bias, low variance give rise to what type of fitting this side? So it is actually called underfitting model, and right side is we call it as overfitting model. So we don't want neither underfitting nor overfitting. Optimal fitting of the model only we expect. So we don't want high bias, low variance, low bias, high variance. We don't want. So the middle one is preferred. And in the bottom most diagram, if you observe, this actually given with underfitting case, and the middle one is the best fitting one. The right one is the overfitting. So overfitting, it's like what you can say, like the student by heart the maths problem without generalizing. So model should generalize the data. It should not by heart, and it should not strictly follow the data, and it should not respond to the noise. In the overfitting case, what will happen? The model will start responding to the small perturbation in the data. Even for the noise data, it will represent. So the rightmost one is the overfitting case, leftmost one is the underfitting case, the middle one is the right one. So what actually we are interested is bias variance trade-off. Any model we want to do the bias variance trade-off, right? Okay, so in general, in case of overall block diagram, if you observe with respect to deep learning framework, there are only four major blocks you come across. One is the convolution neural network based one. Another one is the recurrent neural network based one. Generative adversarial network, normally it is used for, it comes under generative model. GAN is normally used for producing synthetic data, and also for super resolution, and also for denoising, some other applications. GAN comes under generative model, right? Even GAN, autoencoder, variational autoencoder, comes under the generative model. So under deep learning, I mean to say CNN, RNN, GAN, and perceptron. The other one, if you observe, in case of ML, again, with respect to supervised, unsupervised approach, we come across, we come across classification and regression. So the classification job, when the target variable is a categorical variable, it is a classification. When the target variable is a continuous variable, it is a regression task. So it's, everyone knows this. So under again, under the unsupervised one, we use clustering and dimension reduction, as well as the association task we will be doing. In case of unsupervised one, we don't have the target. So here only comes your hierarchical clustering, K-mean clustering. All these cases comes under the clustering approach. Okay, so this one I would like to emphasize. Anyone from the participants know about the two things you have to remember. One is called regularizer, another one is called optimizer. So regularizer is actually used to prevent the model to get overfitting. Regularization, normally we group under two headings. One is called L1 regularization, another one is called L2 regularization. In the last function, we will be adding a parameter to avoid the model from getting overfitted. So the other things normally we do is drop out, and in fact we'll be using k-fold cross validation. These are all drop out, cross validation. These are the strategies to overcome the overfitting problem. In general, overfitting can be mitigated by means of doing regularization. So the other one, if you observe, optimizer, why do we use optimizer? So we want to reduce the error. What is the error here? Say, for example, between the difference between the actual value and the predicted value, you want to decrease. That is where, mathematically speaking, the gradient comes to help us. In the last function, we are going to, if you draw the graph of error, last function. So last function, you want to last function is the difference between the actual and predicted value. You want to decrement. That is where in the literature we do have, starting from gradient descent algorithm, stochastic gradient descent algorithm, and a list of optimizers will be using like Adam optimizer, something like that, right? So regularizer, optimizer. One is used for avoiding the overfitting problem. Another one is used to reduce the error between the actual value and the predicted value. So these are the some of the familiar algorithms used in supervised, unsupervised, and ensemble learning. In the ensemble learning, if you observe like XGBoost, LightGBM, AdaBoost, bagging, and all. In the reinforcement learning, again, actually, reinforcement learning, the broad category, like we go for policy-based algorithm, value-based algorithm. Before that, if you see model-based algorithm, model-free algorithm, environment is modeled as something. So model-free algorithm only, normally in healthcare and all, we are going for model-free algorithm. Under the model-free algorithm, we have a value-based algorithm and then policy-based algorithm. Value-based algorithm, there only we come across Q learning and deep Q learning, and policy-based algorithm, we have policy gradient. The hybrid of these two, both value as well as policy, comes your actor-critic method. See, the entire reinforcement learning comes with two things. One is called exploration, another one is called exploitation. Exploration in the sense, say for example, they keep on searching for good thing, or adhering to a single solution. Both are not good. So we have to explore, and then we have to stick on to a particular thing, right? So like that only. See, reinforcement learning mimic actually the human behavior like learning, right? So next I will touch upon the basic aspect of explainability, which is a more demanding factors, especially in healthcare. So it is a recent definition given by the Artificial Index report 2024 from Stanford University regarding explainability. So the capacity to comprehend, I seek your attention here, please. The capacity to comprehend and articulate the rationale behind the AI decision. So we should know why the AI model has taken some decision. We should be able to comprehend and articulate the rationale behind the AI decision. Emphasizing the importance of AI bring not only transparency but also understandable to user and stakeholders. So especially in healthcare, we want the model to be the very transparent one, and why the decision has to be taken, and which part of the data is important in the signal or image, whatever it may be. why it has given that particular class. So for the explainable AI or XAA, the input is nothing but the data as well as the decision taken by the model, and output should be the explanation. Why the model has taken some decision, that explanation is the output of XAA. So this diagram, if you observe, it is actually giving you some very in-depth reason or rationale behind the XAA technique. And blue colored one, if you see, it's a technical requirements. So technical requirements, we want explainability, we want transparency, we want reproducibility, we want generalization, we want robustness. And ethical requirement, we want the privacy of the data and fairness and accountability. So accountability is a $1 million question. So who is accountable? Suppose AI model makes some flaw, so it has to be subjected to series of tests and all. So accountability, privacy and fairness comes under ethical requirement, technical requirement, and other representative requirements like human value, other things I have given here, right? So, and these dotted arrow and the thick arrow actually indicates like trade-off with and contribute to manifest in. So it's quite self-explanatory. So the model should be accountable, and the decision taken by the model, why it has taken, why you have taken the decision, that has to be explained. And we want the transparency in the model, reproducibility in the model, explainability in the model. It should be generalizable. It should have robustness. That can be bring in by means of XAA technique, explainable AI technique. So we do have different types of XAA. I don't want to get into that. Starting from Lime, GradCam, there are different approaches are there depending upon the data what actually you're looking out for. Whether it is a tabular data or it is an image data or a video or a signal, we can bring in different types of explainability to the decision taken by the model. Okay. So till now I have covered the basics and some idea given. If you have any clarification before getting into the next subdivision, let me answer some of the queries. Low bias, low variance only we prefer, but it's a challenging task. It is a it is actually a requirement where we have to reduce the bias, reduce the variance, both. We go for optimum value of bias and optimum value of variance, where the two graphs intersect. Bias graph as well as variance graph intersect. That point we are choosing it as the optimal one. Okay, let me proceed. Okay, so now the case study I have taken here for discussion is obstructive sleep apnea diagnosis using EEG signal. As I already said, the obstructive sleep apnea is due to the respiratory problem. Often we come across during the sleep that disturb the sleeps. So naturally here we will take help of EEG signal into account. So here in the OSA, there are 3 different classes are there, even obstructive sleep apnea and central sleep apnea, mixed sleep apnea. Obstructive sleep apnea is a more typical variation that appears when neck muscle loosen, and control central sleep apnea. Actually, when the brain and respiratory muscles are unable to effectively communicate, brain and respiratory muscles not able to communicate effectively, means we come across a CSA, central sleep apnea. Mixed sleep apnea, CSA is a term that is used to describe a person when experiences both central and obstructive sleep apnea, both. Among the 3, OSA is a very prevalent problem all over the globe. So as I said, again here also we do pre-processing of the EEG signal, and we'll be taking the features in time domain, frequency domain, time frequency domain, and nonlinear features also. Time frequency domain means naturally you can observe here wavelet transform based on, or we can go for Hilbert-Wang transform. That is where we come across empirical mode decomposition, right? And nonlinear case one, Lyapunov exponent, we can go for Hurst exponent, entropy factors and sample entropy, approximate entropy, Reynolds entropy. So what is entropy convey in general? This entropy tells you about the trend in the time series data. This signal can be also be called as a time series data, right? Time series data, this non-linearity can be effectively traced by means of these features. So in the statistical features and all, we can look out for the skewness, kurtosis, everything. In spectral features, we can take energy. Again, we can also compute entropy for the particular subband, like that we can go, right? So the objective is to classify with normal or sleep apnea. And the database taken is IS RUC dataset and a CAPS sleep dataset and a sleep EDF dataset. It is a statistics about the number of signals used under each case and the mean age for under each data set. Mean and standard deviation is given here. So here, if you observe, we have done the wavelet decomposition. And the wavelet decomposition, why wavelet decomposition? Because as you know, in the wavelet decomposition, normally we are splitting into like approximation and detail. Suppose if you have a signal from 0 to 128 hertz, in the first level decomposition, we are splitting into 0 to 64, 64 to 128. So normally, you know, the basics of wavelet transform comes from subband coding. Before subband coding, we come across the quadrature mirror filter. QMF is the one where we have a pair of filters, where one filter frequency response is the mirror image of the other. Because as we know, the limitation, we cannot construct the brick wall filter. Brick wall filter, we used to call it as an ideal filter, which is impossible to realize. So in general, in any filters, we have a transition region and then stop band, pass band. In the stop band, some amount of energy will be there. Output is not equal to 0. That is why we do go for implementation like a QMF filter based implementation. So why do we go for a number of levels? Here, if you see, they have gone for 5 levels of decomposition. So number of levels is not random, depending on the application, which frequency band you are interested. Say, for example, if you are interested in a band of, say, 16 to 24 hertz. So up to that level, we have to go. That particular frequency band we can choose. So wavelet decomposition comes to help us in this regard, right? A particular subband. So in the bottom, it is indicated, no? So delta component, theta component, alpha component. 5 levels of decomposition, and of course there are various wavelet filters are available, starting from simple hard wavelet, Mexican hat, Debussys. There are different wavelet transforms are there, and in general wavelet transform and wavelet packet transform. In the case of wavelet packet transform, we decompose both low pass filter as well as high pass filter output. Usually in the wavelet transform, again and again decomposition will be done only with respect to low pass filter output, right? So we have like wavelet transform or wavelet packet transform, like that. Depending upon the applications and the requirements, we can appropriately we can choose. These are all some of the spectral features like heart rate, arousal index, neural activity, synchronization, brain perfusion, CNS arousal, desynchronization, and the cognitive performance, like that. So after extracting these features, in general, we used to form a feature table, right? These are all entropy based features given by different authors have used it, starting from approximate, permutation, fuzzy, Reynolds, sample entropy, Hurst exponent, Lyapunov exponent, that all comes under nonlinear type feature. And this particular, I don't know whether it is readable, and it's actually boxcar plot of different components like alpha component, delta, theta, alpha, beta, gamma are the components of the EEG signal. It will tells you the median value for different cases, normal case and sleep apnea cases, it changes, and you can able to see the median value changes, and the range is smaller here for sleep apnea case with respect to beta. So we can very well able to see which feature value is having drastic difference between the two classes, normal and sleep apnea. So particularly for visualizing the feature importance, we may even go for this kind of plots. And this is from ISRUC data set, and right side graph indicates it's actually the support vector machine output with respect to classification. Support vector machine, there is a beauty. It can be configured for normal, that is linear classification or non-linear classification. Linear classification means we will be using the plane or a line like one to classify the data. A non-linear classification means normally we will be using the kernel function. We will be getting into the higher dimensional space. Higher dimensional space in the sense, say for example, I have the features like x. Let me go for x square, x cube, x power 4. So the features which are non-linearly separable in the lower dimensional space becomes linearly separable in the higher dimensional space. We can go from lower dimensional space to higher dimensional space with the help of the kernel function. That is where non-linear support vector machine comes to help us. So the support vector, if you observe, what is the difference? The support vector in the case of linear support vector machine also, it will give you the best fit line. Whereas in the case of perceptron model and all, model does not guarantee that. It will also find the line which separate the classes, no doubt at all. But whether it is a best fit line, that is, it won't give the best fit line. Whereas by means of these support vectors means the data sample which comes very near to the boundary, we are calling it a support vectors. We have to keep the boundary in such a way that the distance between the support vector and the boundary is getting maximized. Okay, so in most of the applications, if you observe, even the healthcare application, ensemble learning based approach as well as support vector based approach gives the better classification accuracy. So in this case also, after extracting these features, after trying out with the different models, support vector machine gives the better classification accuracy. So this case study with respect to EOG signal and electromyogram signal, and it's a recent paper published by our research scholar. So instead of using wavelet transform, here we are using the filter bank based approach. Filter bank based approach, the novel filter bank based approach helps to segregate the band very effectively. So here, if you observe, after doing the pre-processing and segmentation, these signal go through the filter banks to extract the particular band of the signal. Then we are extracting the features, especially the Jorth parameters, which are very much useful for classifying the data. And ML, we have done with the ML based classifiers, all the classifiers are explored, and by LSTM model. By LSTM model, and we have observed that compared to the ML based model, by LSTM gives the better performance, and we have done with two different stages, types of classification. One is stage independent, another is stage dependent. Stage independent means the entire signal will be taking and it will pass through the filter bank, and subbands we are taking, and we are taking the features like that we are going, which is stage independent. Stage dependent means the particular portions, NREM portion of the signal, where we look out for the S1, S2 or S3. From the S1, S2, S3, we do extract features, then it is subjected to traditional process, right? So here we have obtained better performance with respect to the by LSTM model. So this slide gives you some insight about the filter bank, and of course I agree those who are familiar with the signal processing literature only able to follow. So in general, the filter banks we are classifying under types like channel bandwidth and channel central frequency location and overlap, magnitude response, adjacent channel, type of modulation. So uniform, non-uniform, symmetry in the sense with respect to central frequency, we have on either side bandwidth same, symmetry or anti-symmetry. So we have explored here cosine modulated filter bank. Under cosine modulated filter bank, normally call it as a CFB filter banks, where we have different approaches like time frequency resolution, design based approach, and prototype filters, orthogonal and as well as bi-orthogonal. So with respect to CFB type, we got the better results. So these are all what is CFB, and let me leave it to you to please go through this. Those are interested in using this bi-orthogonal cosine modulator filter bank, orthogonal. So I hope you know. Normally, in many applications, linear phase may be the stringent requirement that normally we use. We get it by means of a finite impulse response filter. So in the orthogonal cosine modulator filter bank, we are emphasizing linear phase finite impulse response filter used as a prototype. Using that prototype filter only, we are constructing the other filters, right? So filter bank means it's a group of filters used to obtain the different subbands of the original signal. Like that we can visualize, right? So these EMG signal sampled at EOG signal and EMG signal sampled at the frequency respectively at 512 Hertz and 128 Hertz. And into EMG signal is subdivided into 8 subbands. You can observe here 0 to 4, 4 to 8, finally 256 to 512, 8 subbands EMG signal. Whereas in the case of EOG signal, 6 subbands. For time frequency analysis, we have obviously it's a non-stationary signal, as I said earlier. So those parameters we are extracting from that. These discriminating features both in time and frequency domain using simple calculation. So data set here used is CAP sleep data set, and EMG EOG is used. So we have done it for a 6-class classification. Again, here stage independent and stage dependent. These are all the reconfigurable filter bank outputs. So normally here you come across filter bank theory literature. If you look out for, we call it as one is analysis filter bank. Other group is called synthesis filter bank. Analysis filter bank used to get a different subband of the signal. All these subbands, if you are uniting or joining, that is done by means of synthesis filter bank. So this is accuracy table for normal versus insomnia, normal versus narcolepsy. So for this is stage dependent classification. This is for stage independent classification. And here you can see the metrics like accuracy, F1 score, kappa score, precision, sensitivity, specificity. This is the comparison table for binary classification. This is the recent paper I have observed. They have used the 3D SleepNet model. In the 3D SleepNet model, they are using 2 3D CNN and 1 2D CNN. It is highlighted inside the box. That is actually 3-dimensional CNN. Last one is a 2D CNN. So here they are stacking. Here they are using actually the multi model signal, right? Like EEG, EMG signals and all used. So it's like a frames if you observe. So time domain and frequency band. So these features are combined together, and they have claimed that this give rise to improved accuracy. That model is actually called as a 3D SleepNet model. 2 3D CNN and 1 2D CNN. So in nutshell, I would like to conclude why do we go for this kind of model? Due to these reasons, like early detection and also for personalized treatment. And with wearable devices and IoT, we can very well monitor 24/7. With wearable devices and IoT, remote tracking is possible. So improved sleep hygiene, as well as we can get cost-effective solution. All these approaches are non-invasive approaches. We can also get the real-time feedback. So now let us go for the please. If you have any questions, please feel free to clarify.
Yes, sir.
Yeah.
So regarding that EEG signal you are taking for finding OSA.
Yes, sir.
There are so many waves are there in alpha, beta, gamma, delta. The patient who are in sleeping mode, I think which proper waves we are going to get, sir?
It depends on the application. From the literature, we have to look out for delta, theta. So we can able to extract the particular frequency band. Delta. We have precise frequency range, right? So
Yes, sir.
depending upon the problem which actually we are looking out for, which frequency component is important, that is available in the literature. So that particular subband we can take and we can extract the features, and that will be helpful for making decision.
Yes, sir. Yes, sir. That alpha waves is something related with the patient who are in the sleeping, deeply sleeping mode. In that situation, we are taking the EEG signal. Beta waves is nothing but busy thinking. Who is I am listening to your lecture. Now the beta waves will be generated by in general for a human being. That will be helpful for, I think, OSA identification or detection. For
Yes, sir.
EEG, alpha waves time is useful for finding all the filter bands, everything, sir. Sir, one more thing regarding that threshold value, how we can set for SVM or whatever the things classifier we are using. And one more question is how we collect the data set for finding that OSA, sir. Where from we can collect data set?
I have benchmark data sets are available.
Okay.
In general, we have like a polysomnography, which is a combination of EEG signal and EOG. We have a benchmark data set. I given the list, no?
Okay, sir.
From that you can collect it. And regarding the threshold value, we have to do some kind of hyperparameter tuning. It's not
Okay.
very easy to find like a threshold. So for which kind of, say for example, we have to go like a learning rate, the combinations like optimizer, regularizer. So and how many epochs. So these are all things we are supposed to take into account, for which combination we are getting the best accuracy. Like that only we have to look out for. We have the methods like grid search CV to do the hyperparameter tuning.
Okay, sir.
In
Thank you.
general, it is machine learning or deep learning. We are supposed to do the hyperparameter tuning for getting the best results.
Yes, sir.
Is any other clarifications if you have? Any specific doubts with respect to your research in thing? Research studies also you can ask.
Sir,
Yes, madam.
okay, in your analysis for wavelet decomposition, you are incorporated a 5-level stage decomposition. Is any peculiar reason for that?
Madam, number of levels of decomposition depends on your application, madam. We need not do the decomposition unnecessarily.
Okay, so my
Which
question is that, is there any connection with a specific connection with the OSA analysis?
that is what I'm interested in breaking the particular subband. No, let me get into that slide. I'm interested in getting that particular subband that I am getting after doing the 5th level decomposition. Each level, if you see, you will be getting here delta component, theta component, alpha component. I am getting,
Okay, okay.
So for getting the particular frequency component only, we have to fix the number of levels.
Okay, okay. Thank you, sir.
Thank you, madam. Okay, thank you very much. If so, we'll again meet in another 5 minutes. Let's break and we'll again reassemble here for our next session. Thank you. Let me stop recording.